Maricos, back with another session here, taking the topic of neuroblastoma. Neuroblastoma is most common extracranial tumor. Neuroblastoma most common extracranial solid tumor of childhood and a most common intra-abdominal tumor, the second most common being Wilms tumor, which we have discussed in a previous video. Two-thirds of the cases of neuroblastoma arise in abdomen, mostly from the adrenal gland, and other sites include organs of Zuckerkandl, posterior mediastinum, pelvis, head and neck. Neuroblastoma primary developmental locations first is from adrenal gland and second is from spinal nerve roots, but these are very rare, the most common being the adrenal gland. So, it is mainly confined to the age group of less than 2 years of age. It can occur in between 1 to 4 years of age, but the most common age group is less than 2 years of age group. And there in the Wilms tumor, it is in between 3 to 4 years of age. It originates from the neural crest cells. So, other diseases which arises due to neural crest cells problem may be associated with this neuroblastoma, like Hirschsprung disease and neurofibromatosis, can be associated with the neuroblastoma. Its most common site is adrenal gland and sometimes to the paraspinal sympathetic plexus. Genetics. NMIC gene is an oncogene which amplification can lead to neuroblastoma. ALK gene fusion, which is associated generally with familial neuroblastomas, deletion of chromosome 1q and 11q. Coming to clinical features, most common presentation is abdominal mass which can cross the midline. Pain can be abdominal pain or maybe bone pain or localized back pain. Proptosis, periorbital ecchymosis, raccoon eyes resemblance in the children of neuroblastoma is very commonly seen because of orbital metastasis. Horner syndrome, meiosis, ptosis, anhidrosis, and inophthalmos. Abdominal mass crosses midline, differentiate it from Wilms tumor where the mass is confined to one side. Plus, the mass on CT scan shows calcification. Skin shows when the neuroblastoma get entrapped in the skin, it can lead to blueberry muffin lesions like appearance, which is also seen in a torch infection, mostly in the rubella infection. Weakness due to spinal cord compression. Childhood rubella, the congenital rubella syndrome is associated with the blueberry muffin, not the adult one. Weakness due to spinal cord compression when the neuroblastoma goes into the spinal cord. This is a picture showing raccoon eyes. You can see here the raccoon eyes. Paraneoplastic syndromes are usually associated with neuroblastoma. It is a commonly presents with neuroblastoma while it is not there in the Wilms tumor. So first paraneoplastic syndrome is opsoclonus myoclonus syndrome. It is the generally when any tumor associated with is associated with the paraneoplastic syndrome, it leads to a very poor prognosis, but this is not in the case of opsoclonus myoclonus syndrome. It is generally associated with a good prognosis. It is present in 1 to 3% of the children, and characteristically the describing feature of this opsoclonus myoclonus is a rapid dancing eye movement, rhythmic jerking movements of limbs and trunks, and ataxia. And also there is a secretion of VIP. VIP levels become more than 75 picogram per ml, leading to abdominal distension, intractable secretory diarrhea with hypokalemia. Coming to histopath of neuroblastoma, it can present as a small round blue cell tumor or maybe Homer-right pseudo-rosettes. You can see this Homer-right pseudo-rosettes, and it is not a characteristic feature of neuroblastoma because it can be found in other diseases also. Also, the small round blue cell tumor is not a characteristic for neuroblastoma. You can also see these small round blue tumors in the Ewing sarcoma and some other cases. For investigation, you should note that a primary investigation being MRI and CT scan, the best test for metastasis is MIBG scan. You can also go for CBC, urinary catecholamine level, in which you will check HMA and VMA, which are the metabolites of epinephrine and norepinephrine found in blood and urine. And bone marrow aspiration and biopsy can also be done. CT is done to detect metastasis, but the best test for metastasis is MIBG. Specific marker for this is NSE, which is a neuron-specific enolase, as the neuroblastoma is a neuroendocrine tumor. Now, some differentiating feature between neuroblastoma and Wilms tumor. Neuroblastoma associated with opsoclonus myoclonus syndrome, while Wilms tumor is with Weger syndrome, Beckwith-Wiedemann syndrome. Neuroblastoma cross the midline, while Wilms tumor does not cross. Neuroblastoma usually fixed or immobile, while Wilms tumor may be displaced. Neuroblastoma generally associated with the constitutional symptoms like opsoclonus myoclonus, VIP level increase will lead to secretory diarrheas, like these type of constitutional symptoms. Well, this is not usually associated with constitutional symptoms. Neuroblastoma child is really very irritable, and because of that tenderness in that abdominal mass, while Wilms tumor, this mass is generally asymptomatic. Neuroblastoma, in the skin there is blueberry muffin lesion, in the eyes there is raccoon eyes, some degree of wasting due to spinal cord compression, urinary metabolites are seen, calcification on film, while in Wilms tumor there is macroglossia, aniridia and hemihypertrophy. Beckwith-Wiedemann syndrome is a common association with Wilms tumor, and there is claw on CT and IVP and hypertension, hematuria. Here you can see some calcifications in the neuroblastoma, and also it is crossing the midline. The staging part of neuroblastoma, it can be staged by INSS, that is International Neuroblastoma Staging System, or INRGSS, which is International Neuroblastoma Risk Group Staging System. INSS includes resectability, lymph nodes present or absent, distant metastasis, age at diagnosis. So the important staging for us is INSS staging system. Here you can see this INSS staging system, in which the stage 1 include in the stage 1 the tumor is confined to the adrenal medulla, and therefore it is completely resected. And in the stage 2 there is lymph nodes may be absent or may be present. So when 2A its lymph node are absent, and in the stage 2B lymph nodes are present, but it do not cross the midline. In third stage, tumor crosses the midline. In fourth one, there is a metastatic disease or disseminated disease, and in fourth S, there is metastasis to liver, skin, and bone marrow. But this fourth S is gives us a most favorable outcome irrespective of higher stage and so much of metastasis. It gives us a most favorable outcome. Also, we can classify it like L1 is given to the stage 1, L2 to the stage 2 and 3, M to the stage 4, and MS to the stage 4S. Treatment includes L1 and L2. For L1 and L2, we can go for surgery. For M, we can go for surgery plus chemo plus radiotherapy. In the chemo, we can give cisplatin or cyclophosphamide. Prognosis for neuroblastoma may be good in some conditions, or poor. Good when the child age is less than 1 year, stage 1 to 4S. Hyperdiploidy, note this, hyperdiploidy. In cases of hyperdiploidy, the prognosis is really very good, but in cases of hypodiploidy, prognosis is poor. Age more than 1 year, the prognosis is poor. Stage 3rd, stage 4th, prognosis poor. Chromosome 1 deletion and MYC amplification also gives us a poor prognosis. Thank you for watching my video. Do subscribe my channel and share, and also comment the topic you want to be discussed here. Thank you.